Hi, Dr. Windisch from Sparks Pediatric and Adolescent Medicine. Welcome to our video series for parents. Please remember that these videos don't replace visits with your regular physician. If you have questions about your child's health regarding this video or any of our other topics, we'd be more than happy to see you here in our office at area code 775-359-7111. But please remember, we can't help you over the telephone or the internet. That would be bad medical care, and that's not something we're prepared to put your child at risk for. Today what we want to talk about is sleep in children. The overwhelming majority of my pediatric practice is sleep deprived.
Well, I tried, but,
Probably 80% of kids in the United States are getting less than adequate sleep. And most people don't really know how much sleep the kids need, so that's really what I want to talk about here. When dealing with young children, infants, toddlers, the number one reason that they don't sleep well is because they're behind on sleep. When they get tired, they become cranky, and they have difficulty falling asleep. And when they do fall asleep, it's fitful, and they wake back up. So the key to getting your toddler and your child, your infant, to sleep well is to make sure they're getting enough of it. And that's hands down step number one. So let's start with newborns. How much sleep should they have? Well, it really depends on the newborn, but most newborns are sleeping roughly 18 to 20 hours a day for the first 2 or 3 weeks of life. For a child under 6 months of age, there's no reason they should be awake for more than 3 hours at a sitting, 3 hours at a pop. After 3 hours, they need to be in bed for a nap. If you skip a nap, you'll find your 2-month-old has difficulty with more and more and more, with subsequent sleep episodes, and it becomes a spiral out of control. The answer to it is getting them down into a dark, quiet place. For children who are 6 to 12 months of age, they need roughly 13 hours of sleep a day. That includes 2 naps, a morning and an afternoon nap. For children 2 years of age, they need roughly 12 to 15 hours a day, and they're usually taking 1 nap in the afternoon. 3-year-olds need roughly 11 to 14 hours a day. 4-year-olds need 10 to 13 hours a day, often still with a short afternoon nap. 5-year-olds and up need 10 to 12 and a half hours of sleep a day. So if your child's going to bed, and that 10 hours of sleep really takes you through high school. So if your child's going to bed at midnight and up at 6 o'clock in the morning to go to school, they're sleep deprived. It affects learning, it affects emotions, it makes you depressed. Enough sleep deprivation will make you hallucinate. It affects growth. You secrete growth hormone in deep sleep. If you don't go into deep sleep, you don't secrete growth hormone. If you don't secrete growth hormone, you don't grow in height. It affects blood pressure. It affects blood sugar because growth hormone is a sugar regulatory hormone. So all of these are issues that you want to help to overcome. So what do you do for a child to help them to sleep? Well, step number one, for newborns, they need a quiet, dark place. In the middle of the living room with everything going on is not a good choice. It won't work. As the kids get older, they may be able to nap in other places, and that varies from child to child. Establish a good pre-nap or bedtime routine. Now we change into our jammies, now we brush our teeth, now we read a book, now we go to bed. After dinner, encourage your children to have quiet time. So we stop running around, we stop playing actively, and we engage in quiet activities so that they're not riled up. For older children, avoidance of caffeine from late afternoon forward. Remember that caffeine has a roughly 12-hour half-life. So if your child has caffeine, as in a soda for dinner, they're caffeinated at bedtime. Encourage your toddler, even if they're trying to drop a nap, to have quiet time around nap time and to engage in some quiet play for 30, 45 minutes. A lot of times they'll discover that they are in fact sleepy and take a short nap. And even if they don't, the rest during quiet time is important. I hope this has been enlightening for you and been helpful. If you take anything from this, my take-home message is, remember, the key for a child to get enough sleep is to make sure they get enough, because being sleep deprived predisposes the children to not sleeping well, and it becomes a vicious cycle. If we can be of any assistance here, our phone number is 775-359-7111. We'll see you next time.